joined now by Phumla Williams, the Deputy, or the Director General, I should say, at the Government Communication and Information Systems. Ms. Williams, thank you very much for your time. I want to go specifically to the issues that are playing themselves out in Charlotte Maxeke Academic Hospital and the St. Augustine's Hospital in KZN. Healthcare workers in snaking queues, frustration. Are you able to give an answer as to why we're seeing a shambles outside these two vaccination sites?
Kolani, I missed your first portion of the question. I don't know whether it will be too much to request you to repeat it. I think we spoke at the same time, and I missed what you were asking.
All right. I'm simply asking about the shambles, Ms. Williams, at the two vaccination sites. Charlotte Maxeke Academic Hospital, healthcare workers who are not vaccinated, they have been in queues since yesterday. They're being turned back today and being told to come back tomorrow. In St. Augustine, it's a similar problem, very long queues there. Was government, or is government adequately prepared to carry this out, or is it not?
Kolani, let me start off by thanking South Africans. You know, we are where we are today, and if you look back, when we first announced that we are going to introduce the regime, which is one of our intervention around the fight of COVID-19, and that being the vaccination, there was a huge uproar in terms of people saying we will not take it, it will turn us and make us horses, we will not do it, we will discourage our grannies. Today we are at the point where even researchers, independent researchers, are telling us that over 70% of South Africans are ready to take the vaccination. I think that's the starting point. The second point that I also want to use this platform to say, we are eternally grateful with everybody who has appreciated the need of joining with government, because there is an acknowledgement that this is not a task that government can do alone. In this whole drive of the second phase, we have business with us, we have traditional leaders with us, we have got church leaders with us, who are all out and joining also with GCIS in doing the last round of saying, South Africans, we are ready to enter into the second phase. Yes, you are citing these two examples. Unfortunately, from where I'm sitting, I'm in Pretoria. I may not have the details of what really transpired. Remember, it's still the Sisonke project, which I think they would be even better prepared to respond to it. But what we are currently saying, we are ready on a massive scale come the 17th of May. We are having businesses that are saying, yes, we are ready to avail our facilities. The medical aids are saying we are ready to participate. The clicks, the Discam, the whole range. So we are not anticipating that we will have these challenges. We are having over 3,000 vaccination sites that will also try and minimize a congestion in a particular district. The Department of Health, together with the provincial health, have done a lot of mapping. They have got down to saying in each district how many people will be eligible for the second phase vaccination rollout. They have a sense of how many they are there. We are this weekend, we are all in our provinces working as core teams, which is health, ourselves, and community development workers. We're going to the villages because we are not going to take the assumption that everybody's going to have a cell phone. So we're all over in trying to speak to the gogos, and also we are acknowledging that in rural areas, slowly, there's still some challenges. There are still some gogos that will want you to sit down with them and explain what is going to happen. That's what we are doing currently. We're going all out in making sure we clear all those gaps. It is unfortunate that, yes, there are some of those challenges, but I think the Sonke project, they would be better prepared to talk to it. But yes, we are ready from the 17th.
All right, Ms. Williams, I want us to just take a short pause for a moment, take a breather. So we are in conversation with the Director General at Government Communications, Phumla Williams. And you've heard her, if you were with us before the break, she says emphatically that the country is ready with the vaccination drive. But, Ms. Williams, I put it to you, we are not. Because if we were, healthcare workers would not be wasting precious time in long queues outside Charlotte Maxeke and St. Augustine in Durban waiting to be vaccinated. We're not ready, are we?
Tolly, I think I'm not going to be arguing. I've explained that the current phase, remember when government announced it, it was the Sisonke project, and the program is running its own course. And I'm here to talk to South Africans that from the 17th, over 3,000 vaccination sites will be operational.
Okay.
I'm saying we are inviting all the people who are over 60 to go, who have registered. I think I must also qualify that. We have requested people from the 16th of April, if I'm not mistaken. The minister is on record in having requested a lot of people who are over 60 to register. And one of the reasons...
Can I just quickly challenge you on that, very quickly before you move on? Fine, I take your point. A Sisonke project is separate, or is being handled separately from the phase 2 of the drive, which is going to start on Monday. If you're so sure, Ms. Williams, that the country indeed is ready to roll out this massive program, why in the world would government think that people, elderly people, will know how to use the internet for them to register themselves? Some of them can't even use a cell phone. Isn't that a failure in planning to begin with?
Tolly, I think I did say that we are ready to start the second phase. I didn't say we are 100%, but let me answer the question that you are raising. There are so many channels that we have opened for registration. We've opened an SMS, we have opened a smartphone, we've opened a WhatsApp, we've opened a call center, we've opened a face-to-face. And that's what we are seeking to address. We are aware that people in districts, for instance, the program that I'm saying we're running over the weekend, we will be with the health workers, we will be going to these villages, we will sit down with Umakulu, and we will take the details and we will write down the details so that the information that is critical is uploaded by ourselves. So I don't think we are taking a one-size-fits-all.
Okay, so once...
And we're also going as far as saying, if you have a smartphone and you are facing challenges, we have also activated a call center where you can call.
Okay, so you've taken the details of Umakulu in the Eastern Cape.
Yeah.
Logistically, where is Umakulu going to be vaccinated? Is she expected to take his or her cane and walk some distance to a vaccination site where she will then get her vaccine? Or are you going to have health workers, community health workers as well, going to administer the vaccine? Basically, are they expected to stand in long queues?
Thank you very much also for that. What I can also share with you, Connie, is that we have gone to old age homes because there is an acknowledgement that there are these grannies who are there. That process has been done by the health practitioners where they are. What we are seeking to do also in the villages, the Department of Health has done a lot of work in mapping out where the population that is required for phase 2 are going to be residing. we have put together a pamphlet that will be in all the languages. When we go to these villages, we will make sure that the back of the village of the pamphlet has got a local clinic that Umakhulu goes to so that she can be vaccinated there. But also when we do the face-to-face, we will be able to assess that this old lady is not in a position to go to the clinic. So those arrangements, we have factored them into our planning. But what I also need to say, we're working very closely with community radio stations. The community radio stations are also going to be one of the vehicles that we are using so that there is no situation where the old people go and flock in the clinic when there won't be any vaccination taking place. So we're making sure that when the time is there for that particular clinic vaccination site is activated, we will make a lot of these announcements, but we're also using the loud hailers. We go into this village and we talk, we're using our communicators and our community development workers to advise them that yes, on Monday there will be vaccination, and by that time, our understanding of the registration is to also provide the Department of Health with the appropriate data of how many people have been vaccinated in this village. So they have a sense of how many people they are going to be dealing with, which assists them in planning and avoiding the congestion in that particular area. There's also a program that we are doing also with the Department of Social Development to also target the day of payday when the old ladies are going to be there. But ideally, we want to work towards getting them where they are in their particular districts.
All right. So from what I understand you to be saying is that long queues are going to be avoided at all costs, but queues are going to be there. Old people, 60 and above, are going to be expected to stand in queues for them to get their vaccinations. Yes?
We are not anticipating huge queues, but we are South Africans and we appreciate that somebody may have got it wrong and said, no, and then they end up there. But we try as much as possible to minimize the abuse of elderly people in those vaccination sites. And I think the message we would like to send to South Africans to say, please come and vaccinate. It's the right thing to do. But also, if you allow me to use your platform to say, we still are expected to adhere to the COVID-19 protocol. I know the elderly people will start saying, no, it means I can go to a funeral. It means I can go to a church. We are still pleading with them that, yes, you still have to wear your mask. You still need to wash your hands. You still need to keep your social distancing. Yes, it is an added protection in vaccination. Yes, we expect you to adhere to the health protocols.
All right. Ms. Williams, I am sorry to rush you. I'm completely out of time. So, the next question, it literally is less than a minute. How many vaccines are in the country right now, therefore, waiting in preparation for the vaccination drive that starts on Monday?
I think I had the figure, but you've given me the 1 minute. I don't think I'll be able to give you, but I know that there's a consignment, two consignments that have come already of over 300,000, and we're expecting another 600,000 next week. In fact, basically, we are going to be receiving huge consignment on a weekly basis of about 600,000 on a weekly basis. But you wanted me to give you a 1 minute, but yes, we've got over 6,000.
I'll forgive you for that. Thank you very much for your time. Phumla Williams, the Director General at Government Communications. Thanks indeed for your time.